In this lecture, we will discuss the Cidofovir from all aspects. Along with that, we will also discuss the different scenario related to the Cidofovir. So before starting, we will discuss the different scenario related to the Cidofovir. So first scenario is a patient with advanced AIDS presents with blurred vision. So that is important thing. AIDS patient presents with blurred vision. Fundoscopy confirms CMV, cytomegalovirus retinitis. Which antiviral drug is indicated for this condition? So the answer is Cidofovir. So it means that Cidofovir is used for the CMV related retinitis in AIDS patient. Next scenario is a transplant patient develops HSV infection, herpes simplex virus infection, unresponsive to acyclovir due to a thymidine kinase deficient strain. A HSV, herpes simplex virus strain having no thymidine kinase enzyme that actually activates the different drugs. Which antiviral can be used in such resistant cases? So patient is, you can see the HSV infected, herpes simplex virus infected patient. So in that case, the drug will be the Cidofovir, because Cidofovir doesn't require any kinases for its activation. Otherwise, acyclovir do. So that is why the answer will be the Cidofovir, because it doesn't require any kinase for its activation. Third scenario is which antiviral drug is always administered with probenecid and IV fluid to reduce renal toxicity? Again, the answer is the Cidofovir, because Cidofovir causes nephrotoxicity. So that's why we take Cidofovir along with the probenecid and the IV fluids. So now we will discuss the mechanism. Cidofovir is basically a deoxycytidine monophosphate. It becomes active inside the cell into the deoxycytidine diphosphate with the help of the host kinase enzyme. It doesn't require the viral kinase, it requires the host kinase for its activation. Now it will, after activation, it will become the deoxycytidine diphosphate. It will just analogous to the deoxycytidine triphosphate, which is already present in our cell. Now in the synthesis of the DNA, you will see we require the DNA polymerase enzyme that actually add the different nucleotide. Adenine nucleotide, adenosine in front of this thymidine, guanosine in front of the cytidine, and this process will continue. If the now DNA polymerase has two options. It can bind with the deoxycytidine diphosphate or deoxycytidine triphosphate. If this enzyme DNA polymerase add deoxycytidine diphosphate, which is a drug, in the synthesis of the DNA, then ultimately you will see the terminations of the synthesis of DNA, and there will be the no synthesis of the DNA after adding the drug in the DNA. And that's why when there is no replication of the DNA, then there will be the no replications of the virus. Next, Cidofovir brand name is Vistide, and it is given through the IV route, and it will always be given along with the probenecid and the IV fluids to reduce the nephrotoxicity. That is the most important adverse effect of the Cidofovir. Next, if we look at the clinical uses, Cidofovir is good for the CMV, cytomegalovirus, that causes the retinitis, specifically in the AIDS patient. It can also be used against the herpes simplex virus, as we have already discussed in the different scenario, and human papillomavirus can also be affected by the Cidofovir. And adverse effects, you will see the nephrotoxicity, and we will reduce the nephrotoxicity by taking Cidofovir along with the probenecid and the IV fluids. Neutropenia reduce in the neutrophil, and ultimately your patient can get the different infection due to the reduce in the immune system. Metabolic acidosis, and you can also see the nausea in that case. So this is all about the Cidofovir. If you still have any question, you may ask in the comment section. Thank you so much.